Good evening, everyone. I'm really pleased to invite you back to our Zoom call tonight. This is the Health Association of African Canadians coordinated call this evening. We are coordinating this as the Health Association, but we have invited people from all different sectors to be on this call because we want to explore other sectors. For those of us who are members of HAAC, it wouldn't surprise you to know that we think that everything is about health. It all falls under the social determinants of health, but we are absolutely not equipped to speak about aspects such as business and the economy, justice, and even the social supports. We have people who have expertise in that, and we're so pleased that they're joining us tonight. So they are going to be speaking about those sectors when we get to that point. So just to be very clear about who those people are, I will start by introducing myself and then speaking about them. I'm Sharon Davis-Murdoch. I'm the co-president of the Health Association of African Canadians. My co-host tonight is Rhonda Atwell, as she was as well last week. She is in a brand new position at the Nova Scotia Health Authority. She is the African Nova Scotian Health Consultant. We are very proud that she is in that role, and delighted that she'll be helping me to host this evening. She is also a member of the HAAC Board of Directors. Now, as well, we have other board directors who have other roles, including the doctors Hawes, Dr. Jacob Cookie, and Dr. Ron Milne. Just briefly, Dr. Hawes is retired, but he is and always will be an infectious disease specialist. Dr. Jacob Cookie is a psychiatrist. Dr. Milne is a family doc, and he is with the Nova Scotia Brotherhood Initiative. We also have online, at least I think we have, Omi Sharon, who is the James R. Johnson Chair. She isn't here right now. She will be joining us. I expect we will also have with us to talk about social supports, the ABSW President Crystal John. We also have Tara from the North End Community Health Center, and we have Deacon David Provo as well. Barbara Hamilton Hinch will also be joining us and may have a few words within that social support section. Rustam Southwell has been invited to speak about business and the economy, and we have some justice experts, and they would include people like Angela Simmons, certainly Robert Wright. Elle Jones is also online, and she will speak in this area. We may have Shauna Hoyt, and we'd be delighted if she was able to say a few words when we come to that part. So without further ado, we're going to start with Dr. David Hawes, who Dr. Gaynor Watson-Creed is unable to be with us this evening, but Dr. Hawes is going to kind of give an overview of COVID-19, some of the most important public health messages, and he's also going to be answering some of the questions that we've received over the last week since the last call. So David, over to you.
Okay, thank you, Sharon. Everybody see that slide?
Yes.
And you can hear me okay?
You can.
All right, so what I thought I'd do very quickly is just to go through a couple of things about COVID-19, because I feel if we're informed as to some of the basics, that will help us with some of what's going on now with prevention and the whole public health issue. So we're in a pandemic state with COVID-19, and it started somewhere. And we know that China was the kind of place where this all began. And there's going to be an end. One day there will be an end. And I'll tell you a little bit about that. So the beginning, really, and the rapid spread of this infection around the world really is related to two main factors. One is that it's the first time human beings have seen this virus. So we absolutely have no immunity. And so there is nothing in us that helps to modify the virus. So we have no immunity. And the second big factor is human behavior. And what are the aspects of human behavior that spread this virus? Here are some of them. We're social beings. And so when we meet and greet, we're close to each other physically. We don't talk to each other across the rooms or across the street or whatever. So talking, coughing, sneezing, these things, because the virus is in the respiratory tract, these things produce respiratory droplets which contain the virus. And so these then spread out and other people can become infected. Here's a couple of other things that we do. We shake hands. It's a social thing, right? And when the droplets, when somebody's hands are contaminated with this virus, then shaking hands transfers it to somebody else. If the virus, if the droplets lands on objects and we touch those objects, and then we touch our nose, our mouth, our eyes, then that infection is transferred to us as well. So our own behavior has played a large role. You know, if we all lived as hermits and one of us became infected and we were up in our cave, wherever, at the top of the mountain, that viral infection would stop there. But unfortunately, we're not hermits. And the other factor is our technology is so great that you can be in Australia one day and in a day or so, you can be in Canada. So even before you feel unwell, you're in another country. And so we transfer these infections at rapid speed around the world. So the end will come. And what's going to bring an end to this pandemic? This virus may well be with us for eternity. It may not disappear. However, the pandemic and the rapid spread of infection in our communities will become moderated. I'm sorry, is there somebody? Somebody needs to mute their microphone.
Please mute your microphone.
So once we develop immunity, then that will moderate. It may help to destroy the virus when it gets into our bodies, or just moderate it so it doesn't cause the harm that it's causing right now. And there are different ways of developing immunity. There's passive immunity, where you can take antibodies from someone who's been infected and recovered and use that to help someone fight the infection. And then there's natural immunity, where someone becomes infected, their body fights it off, they recover, and they have natural immunity. So in the short term, we feel, or the sense is, that somebody who has just gotten infection will not get it again in the short term. We do not know in the long term. And then the other big thing that we're all waiting for is a vaccine. So when we have a vaccine, it's a when, it's going to be about 12 to 18 months. That vaccine can be used to immunize large groups of people so that, again, we have immunity to this virus as a group, what we call herd immunity. And that will bring an end to the pandemic as well. So nobody knows when this is going to end. Nobody knows if this is going to wane over the summer and come up again in the fall and winter. But we need to get through this, and there are things that we can do to help us get through. And basically, for people who are unwell, having a drug to treat this infection is also a very key thing. And so that is being worked on as we speak. In the meantime, it's really supportive care. So everybody has heard a lot about this flattening the curve, flattening the curve. I just want to go through that very quickly because this really is a crux of why public health measures have been put in place. So if we do nothing to change the course of this viral infection in our community, that red curve is what we will have. There'll be a large amount of infections in a short period of time. And the whole issue is that our healthcare system will be overwhelmed. There'll be too many people will become unwell, need ICU, need ventilators, hospital beds, etc. We'll not be able to handle those numbers. So the idea is to go with that blue curve, is to do things that will slow the spread of virus in our community. We may still have the same number of people infected at the very end, but at least we'll not have that huge spike in cases. So that's what people talk about when they say flatten the curve. It's to get the number of acute cases down to a level where the healthcare system can handle that, even though it's going to take a longer time before you actually get rid of the virus. So I hope that's clear, and I can take questions after. So as you all know, we're now in a state of emergency in the province. And federally, there is something called the Quarantine Act, which you've probably heard of as well. And they dovetail each other. So the provincial state of emergency mandates, so let's say 2 weeks ago, you could meet in a group of 10 or more, and let's say you're on a street corner meeting. A police officer could come along and suggest that you move along and that maybe you guys, you should be a certain distance from each other, etc. With the state of emergency, the police now have the power to fine you and to force you into staying away from each other, being in smaller groups. So basically what the state of emergency said, if you do not have to go out of your home, then please stay home. It talks about self-isolation, but basically there's a little bit of a difference there from what we're going to talk about later. But essentially stay home. If you need to get groceries or do something essential, that's great. But if you do go out, then you maintain that social distance or physical distance of 6 feet from each other, again, to minimize the chances of infection being transferred to another person. We're only allowed to meet in groups of 5, no more than 5 people. And again, the idea is so that we can maintain that social distance. If we have a business that has to continue going, then again, 5 people, or if more than 5, then again, that social distance has to be there. And the key thing that we, in a personal way, wash your hands often, or you use the alcohol hand sanitizer. Clean surfaces and do your best. There's a study that showed we touch our face about 23 times every hour. It's very difficult not to, but we need to discipline ourselves. And if we need to touch our face or eyes or whatever, wash your hands first or cleanse your hands in some way. And I saw this neat graphic and I thought that was great. We're all in this together, just 6 feet apart. Together, we can do this together. So I just want to talk about isolation before I go to the questions very quickly, because there's some misunderstanding, and I hope I can clarify that. So we've been asked to do isolation, and there's isolation and there's quarantine. So the state of emergency mandates that we stay home. That is not really isolation as such, but we're asked to stay home and stay away from other people unless we really need to go out or do things. If somebody has returned from travel outside the province, either international or interprovincial travel, they're being mandated to self-isolate or really quarantine themselves at home. They may not be unwell. They may feel fine, but they're being asked to stay home for 14 days to make sure you do not develop symptoms. And that 14 days is the incubation period, time between getting an infection and developing symptoms. If you do not develop symptoms in 14 days, in general, you should be okay. So if you return from travel, stay home for 14 days. Do not stop at the grocery on your way home. Get someone to pick up your grocery and drop it off for you. If you're in contact with somebody who is ill, either they're known to be having or proven to have COVID-19 or suspected to be, then again, you're being asked to isolate yourself or quarantine yourself at home, even though you may feel well. And again, that 14-day period, because you may have the infection and you may then develop symptoms. If you have symptoms and you've tested positive, or you have symptoms and you're waiting for your result, but again, high likelihood that you're positive, you're in strict isolation. So this means even in your home, you need to stay away from others in the home if possible. Have your own bedroom, your own washroom, you know, all that stuff. And I know that's difficult for a lot of people, but in the case of voluntary self-isolation, you are allowed to leave your home. You are allowed to go on walks. You can walk your dog. You can walk around your streets. If you're passing people, then you know, run away from each other till you get 6 feet apart. However, if you are positive or you're waiting for your result and you're in strict isolation, you're not allowed to leave your home. You need to stay home until you get better, until your symptoms are gone and you're better. So it's not a 14-day wait, it's until you get better, however long that takes. And I want to finish with this message. So this is the OR staff at the QE2. So they're saying, we stay here for you to help us. Please stay home for us. So again, if our first line medical care personnel become infected, then we're going to be in trouble when we need their help. So I hope that helps. And I just want to, you know, just say I can take questions, but wanted to do that so that at least people have an idea of what's going on. I'm just going to go on, Sharon, if you don't mind, to the questions.
Yes, please.
So there's a question that says, is there concrete evidence that the 14-day self-isolation period is sufficient for the virus to pass, or should isolation be longer? Can a person who has had the virus already become reinfected? So again, the 14-day period is just that period between when you might have gotten the virus and developed symptoms. So it's not there for when you have symptoms. If you have symptoms, you wait until those are completely gone before you can move and say, okay, I'm out of isolation. And again, we think in the short term, at least, people develop immunity so they'll not become reinfected. One of the things I heard was on CNN a couple of nights ago is somebody said, think positive. And it was kind of a puzzle to the anchor initially. But the idea is if you think to yourself that, hey, I could have this infection, how do I protect others? That is the key. What do you do to modify your behavior to protect others? Another question, how are parents who share parenting managing through the crisis? What should they be doing? Now, I think this was answered on the last call.
It was, yeah.
But again, should children continue going to both parents' houses, for example? And again, every situation is different. But again, if you need to share parenting, then you have to make allowances for that. And again, if people are well or have not been in contact with anybody who may be unwell, I think that makes it easier. it becomes more difficult if you have traveled or if you have contact with somebody who has traveled. Another question, now the weather is getting nice. I like to go out for a walk with a friend, usually side by side, not one in front of the other. Should we consider wearing a mask or not walk together at all? I should tell you that wearing masks is an issue that we need to think about carefully. Masks, there are two types, surgical masks and the N95, which are sort of high efficiency masks. N95 masks are really reserved for healthcare personnel who are doing procedures or talking with somebody who is probably or possibly infected. Surgical masks can help if somebody has infection and is trying to reduce the risk to other people. But in general, we do not recommend masks for the general public. Going out for a walk with a friend, again, you both have to look at the risk of being together. And, you know, I mean, households, it's very different. You're in a household together. If it's a friend who lives next door or down the street, I think, again, you have to really think, is that the best thing to do in that situation? It's a personal choice. Testing, does it involve a blood test or a swab? Right now, the testing that's done is a swab, usually in the nose, deep in the nose. There's a blood test that will be developed later on, but it's not going to be helpful in the acute situation right now. Another question about visiting grandparents. With no school going on, no daycare, is it okay to drop the kids off, I guess? What should be the protocol? And I guess, again, not being Dr. Gaynor Watson Creed, I'd say there's a personal choice you have to make. Your grandparents are going to be in the age group that will be more severely affected if they develop infection. So you have to think carefully about how you expose them, not just to the children, but to yourself. Depends again on your situation, where you work, etc. And again, you know, the issue of people who are more severely affected is not only just with age, but also with underlying medical conditions, chronic medical conditions. Soon be done. Another question, speaking of food, can it be transferred by food? So again, theoretically, it can be transferred on the outside of food. So if you pick up, you know, say an apple that somebody with COVID-19 on their hands picked up, you pick it up, you can transfer that infection to yourself. But in terms of regular food, if you have your food cooked, all that stuff, you know, if you're going to eat lettuce or, you know, whatever else, make sure you wash them properly, appropriately, and there's stuff you can use for that as well. And then the other question I'm going to leave for Jacob. I don't know if he is on the line.
I don't see him at the moment, but there was a question that had come up with respect to ibuprofen. And I didn't actually see the whole question, but I think that Crystal John is online. I wonder, Crystal, could you just
Oh, I just see those questions. Okay, let me so how true is the information coming out? Everybody can probably see that, causing the virus to spread more rapidly. So, Crystal, I'm not aware of that being accurate.
Okay.
Ibuprofen, I'm sorry, do you want to jump in there?
Yes, I've just heard 2 or 3 what sound like official notes about it. So, you know, it's kind of come through this recording, which sounds like it's from a doctor. So I was just asking if anybody else had heard about it and how true it is.
I think, was it Gaynor that addressed it, or was it might have been Lisa Barrett, Dr. Lisa Barrett. So the key thing here is ibuprofen is an anti-inflammatory, as everybody knows, that you take for fever or, you know, different things, so arthritis, etc. And there was, I think, one case where somebody was on ibuprofen and there was a suggestion that they might have done worse. But I think the advice is that if you're on ibuprofen regularly for a medical issue, You can chat with your doctor, but there's no reason right now that you need to stop it. But if you do not have to take it, then because there are other things ibuprofen can do. GI bleeding can cause kidney problems. So, you know, you don't want to add those things on top of a potential infection. So I think that was where that came from. Does that help, Crystal?
Yeah, it is helpful. As I
Okay.
said, it said there were a number of cases where, or a lot of the people who died from it actually were on ibuprofen. So I was wondering if there was any connection. But
yeah, and the problem with some of those reports is we do not have the context to know what are the underlying health problems those people had. So, you know, there's no data out there now that says you should stop your ibuprofen because if you get COVID-19, you're going to be in trouble. So that's a short answer.
thank you.
Next question is, those of us with spouses, medical profession, on the front line, should we be concerned or should there be some form of in-house? Well, that's a tough one. I don't know how many of you, I mean, there was an image I saw on TV, well, more than once, where medical professionals who were on the front line were not even going home. There was one guy who was sleeping in a tent in his backyard. There was one guy who had a dinner date with his wife, and they were having dinner like 6 feet apart. So, you know, there's a concern, very legitimate concern, that if one partner is, you know, on the front lines of this infection, there's a potential because there are medical personnel that are getting infected, developing this infection. So yes, I think, you know, but again, that needs to be worked out in your relationship. And in-house isolation is difficult, but yes, that could be an option rather than sleeping in a tent in the backyard. I've heard that there's some Black communities where they're practicing social distancing. There will be a large 65th party on, oh, wow. Get through, yeah. So did you hear about the party in Lake Echo? So it's interesting that the first case that was identified as community spread was from a party on St. Patrick's Day in Lake Echo last week. And so, you know, we all have to do our part to get the message out that we should not be having large gatherings. That's a no-no. That's just a setup for disaster. And, you know, as we talked about that flattening the curve, you can imagine if you have a large group of people who become infected, that's going to be a huge spike. Alrighty, Sharon, I think that's probably enough from me.
Okay, well, terrific. And thank you so much,
You're welcome.
Dr. David. I also want to take this opportunity to thank Russell Gross from the Black Cultural Center for live streaming on Facebook tonight, this call. Again, he did that last weekend. We are so grateful because it meant access for so many people. And we really appreciate that, Russell, so thank you. I want to take the opportunity now to invite the medical and health experts who are on the call, our HAAC people, specifically Dr. Milne. If Dr. Cookie is there, I don't think he is quite yet. Certainly, my co-host, Rhonda Atwell, is on the call. So if you guys want to jump in, if Omi Sheree is there as well, just to give your thoughts about how things have progressed. And Dr. Hawes, there is one other thing that I wondered about, if you know this, if you could share with us where we are in Nova Scotia at the moment in terms of the number of cases, and I am pleased to know, at least I think at this point, and God forbid, we haven't had any deaths at all in Nova Scotia.
Yeah.
If you could just let us know sort of what the status is as of sort of this moment.
So the report from today, Sharon, is we have 90 cases, 90. And so far, there have been no deaths. And I think there were 17 cases identified today. So, you know, the thing is that our numbers of cases aren't skyrocketing. We're still accumulating cases, and we will continue to accumulate cases. But I think as long as we continue to, you know, observe the measures that have been recommended and mandated, then I think Nova Scotia is going to be in a much better position than many other places. So we should not be complacent, because remember, again, there are probably people in the community with this infection that have not been detected. They either have very mild disease, no symptoms at all, mild symptoms, you know, and just have not been tested. So, you know, we have to just assume that any of us could have it. God forbid again, but yeah, anyway.
Yes.
That's
Okay.
the update. Is that okay?
That's perfect.
Yeah.
Yes. Dr. Milne and Rhonda, do you want to say some words?
Well, I do see, hi everyone, Rhonda here. I do see that Falami Jones had asked another question. If we can just go to that question. She asks about how long does the virus last on surfaces? I know this is a concern for a lot of people. Like example, metals, plastics, cardboard even. I know some people are concerned about even collecting their mail. Can you speak to that, Dr. Milne, at all?
I think the evidence they have to this point indicates that the virus can live for hours to days on surfaces, so that it is theoretically possible if you have the virus on a countertop or a doorknob or another surface that you could certainly be in contact with the virus. Whether you can actually contract the disease from that, I don't know, but I guess theoretically it's possible. I don't know, David, if you have a thought about that?
So the key thing here is that the duration of virus on surfaces is different for different surfaces. So that's the first thing. And we don't have to go into a long discourse, but what Rhonda said is, you know, from like 3 hours to 3 days is a kind of sort of average time frame depending on the surface, the material. The key is that these viruses need to live inside the body, and they need to be need to be in a moist environment. Otherwise, they dry out and they will die. And so eventually, viruses will die. Just remember, the test they use to pick up the virus is picking up genetic material, and that virus may not necessarily be viable. It's like if I leave you in the desert without water, you will die without water, but I can still go back, you know, sometime later on and find bits and pieces of your body, but you're dead. So again, just keep it in that context, but be aware that any surface that's contaminated could be an area that you could pass the virus on to yourself. And so that's why the recommendation is to make sure you clean surfaces. We had a question about, you know, picking up the newspaper, getting your mail. Even there was a question about, you know, getting delivery at home because everybody's ordering things now from Amazon, etc.
Yeah.
And the key thing there is that if you handle things from outside your home, make sure you wash your hands or use hand sanitizer. Do not touch your face with unclean hands. So you're not going to be able to prevent this 100%, but you can minimize. And in general, those things, you know, if you think of boxes coming from Amazon or wherever they come from, you know, there's a duration, there's a time there that they're in transit. So again, just keep it in context.
Okay.
Right. Thank you.
Does that help, Fulami? I hope.
Yes, yeah.
All right.
Yeah.
Any final words from our health people, medical experts?
Hi, sorry, I just wanted to ask a question. My name
Sure.
is Nzinga. I'm just joining in late. I wanted to ask, do we know if there's been any confirmed cases among Black and African Nova Scotians in the province?
So we're not going to have that information. Okay. So the public health is being very guarded with the information they give out about positive cases because of confidentiality and not wanting to stigmatize, if you will, particular communities. So we do not have that information. And you can imagine, you know, if you told one community that you have a positive and the other community didn't have any, you know, anyway, so we do not have that information. But there's a question about a false positive or false negative test. And all I'd say about this, I do not have the details of the particular tests that they are using, but all tests, none of the tests that we use are really 100%. They all have even a small amount of, you know, false negativity or false positivity, but it depends on the test. And I understand the test they're using now is very sensitive so that the false negative rate would be low. Okay, so that's all I can tell you, not being in the lab and not knowing the characteristics of the test. But if somebody has symptoms, let's say somebody has traveled or been in contact with somebody who's a confirmed case and you have symptoms and your test is negative, I wouldn't assume then that, oh, maybe this is not. I mean, it could be that it's not, but it could still be.
Okay.
And again, depends on the timing of the test, how long, you know, after symptoms start.
Okay,
Right.
I'm going to just because we have, you know, we have so much to talk about in so little time. I will ask people to send or call HAAC with any additional questions in the health sector that or relating to the virus from the medical standpoint or the health standpoint, and we will try to answer them online, not online, but on our webpage. We want to be able to fit in a number of different sectors and aspects tonight. So I'm going to hand this over to co-host Rhonda to speak about social supports and get people to speak about that as we move forward with the call.
Okay. All right. Thank you, Sharon. Okay, so we know that social supports are extremely important, and we need to know where they are. So we're going to call on Crystal John, who is the president of ABSW, to speak to that, to let us know what opportunities there are in community for our community members and how we can support each other, and where to go, what to look for. Crystal, are you ready to speak to that? Is Crystal with us? There you are.
Hold on.
Okay, we can hear it. Yeah, we can hear you now.
I don't know, something was happening. But as the association, what we are planning to do is to set up a 1-800 number so that community members can call us for information. So we will be gathering information where they can easily access food, of course, mental health services, where they can access different things that they need. The 1-800 number will hopefully be set up by Monday. We're in the process of working through that. And our staff are going to be gathering resources for that number. So we'll be able to take the information in, answer the calls, and then send the information back out. So currently we're getting a few calls, just a few calls on different things where parents that are concerned about their children who are in care. So if children are in care, all of those services have been cut, so they no longer have contact with their children. So we have those concerns, and we are trying to partner with the Department of Community Services to get some of those answers to be able to help parents. But we will have a 1-800 number set up in the next couple of days to be able to field community calls. We've gotten a few community calls that we've we are taking note and tracking the types of calls that we're getting, the types of concerns. As you can imagine, people are concerned about a lot of different things. One of the concerns that some of workers are having is that, and even showing racism in the community, is that, you know, those who are poor and underprivileged are the first to get the illness. So there's already that myth out there that, you know, those who are African Nova Scotian are getting the illness faster than others. And there's also some cases of instances where employees are being let go first. African Nova Scotian employees are the first to be let go in places, even if they were not the last hired. There was one specific instance where there was an African Nova Scotian receptionist, 2 employees that came back from away, came back to work, and they let her go because she was immunity. She had some immunity, so she complained, or not complained, but she asked about that if they were going to be coming back to work. So they brought them back to work and then told her that she was laid off. So that they were salespeople, she was a receptionist. So we're seeing some instances of that, and we just want to be able to support the community and be able to find resources. So we will have resources for food banks, for information. Our website will have the updates as they come.
Okay. Thank you.
You're welcome.
Okay, so we also have Tara from the North End Community Health Clinic on the line. I believe, Tara, are you with us to speak to some of the resources that are available to community?
Yes, I am. Can everyone hear me?
Yes.
Yes.
Okay, perfect. Yes, so I'm one of the social workers at the North End Community Health Center, and we're also going to be starting a 1-800 number that just any individuals of African ancestry across Nova Scotia will be able to call. And that service will be for individuals who are experiencing any mental health concerns. So we'll have some clinicians set up and kind of a coordinator that will coordinate appointment times and phone calls with the clinicians.
Okay, wonderful. Is there anything else to add?
So we're just waiting on funding for that. And that should be something probably that we should get going pending on funding about end of next week. Okay,
that's good. Thank you.
You're welcome.
All right, there's quite a few people to get through here. Sorry, I don't mean to keep skipping, but we also have it's Reverend Britton was supposed to be with us, but she's not. We have Deacon David Provost, who is going to speak to us as well about some supports in the community. Deacon David, are you with us? I don't know if Deacon David is. Veronica, do you know if the deacon is still going to join us, or?
He's supposed to be. I'm just checking his number to see if he is indeed online. He just probably a half hour ago, he asked for the link, so he may be trying to struggle with 221. Oh, is that you, David?
Okay. Hello? Deacon David, are you with us? Okay, well, maybe we'll just wait for him to join in. Okay, so I know also Barb Hamilton-Hinch, Dr. Barb Hamilton-Hinch, you're with us tonight, and you were going to speak to some resources in the community as well. Are you with us, Barb?
Yeah, I'm here. A lot of mine was also going to be in reference to education. So I can either wait, because a lot of the social stuff has already been talked about, or I can talk about the education things right now. It depends on what your pleasure is.
Okay, it's all encompassing, so okay. It's all good.
Okay, because I know there's a number of concerns around the public school system that hasn't released anything official as of yet. But I will let you know that the public libraries have extended their date of opening to April 30th already. And right now, one of the concerns for the school system are the students in grade 12. Well, all of the students who are in grade 12 have been instructed, if your child's in grade 12, to pick up Chromebooks at their local high schools to try to complete the necessary requirements for graduation. The other classes, especially in high school right now, because that's one that I'm most familiar with, are currently asking schools or parents if they're able to have online learning if they had to go through course packages. I did express some concern around that with the assumption that not all parents have internet and not all parents have the access or the ability to be able to teach their children the courses that they would need in order to complete to go to university. So the example I gave was that my son's in pre-cal. He will be doing calculus in grade 12. That is not an area of my expertise. So the expectation for students to be able to do some of those courses online is going to be very challenging. However, there is some really good resources like Khan Academy, and it'd be great if there was a place where we could dump some of these tutorial that are free for parents. And some of the Khan Academy, for instance, is also excellent for elementary school children. And they haven't been targeted yet with what they should be doing at home, but some people have already started to implement reading and then doing reading journaling after they read. So parents are doing that currently on their own, but nothing has come out publicly from the school system. Jumping into post-secondary, and I'll go very quickly, Rhonda, I don't want to take too much of the time, which is where I am, is a number of emails have been coming out specifically from Dalhousie. So I really would encourage those who have students at other universities to really, really be reading closely the emails that are coming out. So for example, at Dalhousie, they initially gave the option for students to withdraw from any courses this term by the end of March 30th. And then just yesterday, they changed that with the option to possibly go with some courses with a pass-fail. So you can finish your whole term, get a mark. If your mark isn't what you would like for your GPA, then you can contact your instructor and ask it to be moved to a pass-fail, and you still get credit for that course. If you finish the whole course and you don't do well and you fail, then you can go to the instructor and ask them to replace it for an IL. So the IL doesn't affect your GPA, but it doesn't give you credit for the course either. So those are some options right now that are coming out for students who are currently in school. Right now, the universities are dealing with currently registered students, and students who are going to be coming into school they'll be getting emails soon. So any student who has already received an acceptance from Dalhousie, that is going to be honored. Some we recognize will have gaps. So some students may not finish some of the required courses like their physics, their math. Some of those other courses may not be finished. So for the next 2 years, we will be seeing September and October being taught very differently in our university system, understanding those gaps may exist because the public school system haven't yet released how they're going to make up the school year. So we can't talk about what's going to happen in university for our incoming students until we know what's going to happen in the public school system. But I do encourage folks to reach out to our academic advisors and any academic advisors in the university that are online. So all academic advisors are listening to incoming students and students who are currently in the system. And I wanted to get rid of any myths out there about international students. Although most international students were asked to leave the university if possible, and that's really important to understand that. We did not kick out international students who weren't able to find accommodation or who weren't able to travel safely to home. And that includes any students. So we do have some international students that are still on our university campuses that are getting support. All of our health services remain open. So if students require counseling, our health services are open on a rotational basis to provide counseling for any students that are requiring that. So we did not close any essential service on our campuses. Students are still able to access them. They're also able to access any counseling online. So we still have tried as much as possible to maintain some of our essential services for university students, and I would hope that most universities and community colleges are using that same structure. But I would encourage folks to reach out and read their emails, because there is lots of information that's coming out that can be very telling. There are some going to some of the physical health, but to me is also equally important to the social and mental health, is that we recognize the fact that a lot of our community centers and gyms have been closed. Lynn Jones recently sent out today a free yoga website. And I think that people need to think about their physical health as well as their mental and emotional health. Mm-hmm. And if you can, where possible, think about some light physical activity. If that means going for a walk for 10 minutes and getting some fresh air, do it. If it means going up and down the stairs in your house, do it. We really need to promote physical activity at a time when people are being very sedentary. And it's easy to sit and watch Netflix. It's easy to lay and watch Netflix and do a lot of binge watching of TV and not thinking about your physical health. And we know that our physical health and our mental health go together. So we have to really maintain the two of them on top of our nutritional health. So Sarah Kirk, I can hear in the back of my head, we don't get storm chips, we get storm carrots. So think about what vegetables and other health food you can eat during this time, and not just the junk food that we're so apt to usually go and get. And there's a number of really fun nutritionist recipes, both for to engage your children and preparing the food in you. And food prep is a great time right now that people are taking advantage of, but really reading those labels to making sure that you're getting the right vitamins and nutritions that you need for healthy body as a whole.
Yes, for sure. Thank you, Barb. Thank you for sharing that. I'll actually expand a little bit more on that later. Dr. Jacob Cookie can't be with us this evening, so he had left some tips about mental health and wellness and how to take care of ourselves. So we'll end with that for sure. Thank you for mentioning that. That's really, really important. Okay, so I don't know I know there's a number of questions that are coming up. I don't think we can get to all of them. There's resources, so just take a look at that, everyone, I would say, as we go along. Sorry?
Rhonda, I do believe Deacon David is online now.
Okay, great. So yes, Deacon David, welcome. Can you speak to some of the resources that are in community around faith and church services? Hello, Deacon David? Can you hear me? Are you with us?
He's muted.
Oh. Okay, are you there? I can kind of hear something.
Is there a way to unmute him? He's muted.
Unmute yourself there, Deacon David, if possible.
Lower left corner of your screen.
Where's his name in the list? I can unmute him. I just don't see Deacon David.
It says David's iPhone. I think that's him.
Yeah, I think so as well.
That's been there for a while.
Oh, there he is.
Okay, good.
Hello, can you hear us?
Hi, everyone. It's Vanessa, just for a second. If you're on an iPhone and trying to unmute yourself, you have to hit *6.
Oh, right. Thank you, Vanessa.
Appreciate that, Vanessa.
Who's ever hosting should also be able to unmute the person in the master.
Carla, are you able to do that? So what is it again, Vanessa? *6?
Yes, you just have to hit *6 and that will unmute you and mute you.
Okay.
Okay,
right.
maybe we'll have to get him to set it in.
Yes.
Yeah,
okay.
That's fine. Okay, so where are we at for time here?
Could I just interject something?
Sure.
Dr. Ron, that Brotherhood Clinic, we've been dealing with our patients mainly by phone. So we are open for business, our Wednesday clinics, to be seeing patients starting next Wednesday. So we do deal, besides health, with a lot of mental health issues. And, I'm available to see those people. As well, we have access in the community to Jacob and other health professionals. Also, we deal with a lot of social, legal, housing issues. So for African Nova Scotian men or men of African descent, we are open for business.
Wonderful. That's good to know. That's good to know. And particularly with the clinics, Dr. Milne, I know that they will see people, I think, on a case-by-case basis. Is that correct?
That's right. Yeah.
Okay. That's good to know.
So time being what it is, Rhonda, I'm wondering if we can move on a bit to economic and business concerns.
Yes,
which
for
I
sure.
know are hugely impacting social supports, right?
Oh yeah, yes, for sure. And I think it's Tari and
it's Rustum Southwell.
Yeah. Rustum Southwell. Rustum, are you with us? to speak to that? About the relief and programs for small businesses and entrepreneurs?
Yeah, good evening. I am with you.
Great.
Great. Welcome.
Yeah, first, let me just say thanks for inviting us here to go through what we know of information that can help economies in the community in terms of supports and some of the initiatives that are coming down. I know Dr. Rhonda Thomas Bernard, the senator, is on board as well. So some of these things we will know as well. We actually, I'm going to go through what we are doing as in terms of the organization I represent, the Black Business Initiative, that we have in place and where we see some of those. And then maybe give an idea of the environment on the economy, because as Sharon pointed out, there are two things. There's the pandemic and the virus, and the impact it's having on the collapse of the economy worldwide, right? Driven to recession, but there's certain areas where it's having huge impact. As a vulnerable community, the Black communities become part of that. So we over the last few weeks, as we know, it's going month to month, then week to week, day to day, hour to hour, minute to minute, and now we're actually talking about second to second and nanosecond to nanosecond, as things change quite quickly. What BBI put in place, we're working remotely right now, so the folks are working from home base where possible and only enter in the office on essential times. We're just getting ready to use our 1-800 number as a resource for the communities to call in, and we will monitor it and answer questions as we see fit. But we've also been collecting data and services that are happening outside and interpreting them so that we can respond to any questions that we have with the community. The levels of governments are having some challenges in responding to the impact on workers, workforce, families, and just money being purchasing. How do you get that into the community? There are several Black organizations across Canada that's been working at the ministerial level, advocating for Afrocentric lens, if you want to use the term, in these decisions that are happening. There's the Push Coalition, I know, is a group, and Meeting of the Minds, which Sylvia Paris I often attend, and I believe Ms. Fells as well from time to time. So there's these things going on simultaneously to protect that area and to make sure there's involvement and consideration for the Black community as a vulnerable group. The government's response from the federal level, for an example, how quickly things are happening. This morning when you got up, there was a 10% wage subsidy. By the announcement of the Prime Minister tonight, it's up to 75%. And there are lots of other services that's been distributed to protect small businesses and business as a whole, and the employment and employees, the other private sector areas. We were asked by Minister Hussein last week to inform the communities the importance, if you're not in business, or even if you are a sole proprietorship entrepreneur, the importance of filing your taxes. And we understand that sometimes in our own community, people don't file, but speaking to Joe Paris with CRA today, the key thing on that is the quickest way they can get the supports to your bank accounts, the $900 and those supports, because they have that information. So if you have filed since 2018, my understanding is you would be in their system, but if you haven't, the minister indicated that there's no penalties for late, or even if they are arrears. The idea is to have that out so that you can get any kind of supports coming to you, and that's the quickest way they can get that out. If you were following the announcements today, for example, apart from the 75% wage subsidy that was to be given out, there are other things like the goods and service tax for those of you who are in business, goods and service tax, and those HST, your income tax, those are deferred for June until June as well. and there's interest-free loans that are available under the Canada Emergency Business Account and Business Funding. So there's a move to make sure that you can get money into the families, supports for small businesses as well. For the detailed information, and I can answer some questions if folks have things that I've missed. For detailed information, if you went to the Canada.ca and /COVID/business, you would get full information on the support for employees, on the Canada Emergency Response Benefit. That is up to $2,000 per month, $2,000 per month, up to 4 months for workers. The waiting period is streamlined now down to 1 week. And also the Canada Child Benefit Package, which is the one I was saying, if you have your taxes, that would come to you automatically. The others, on the emergency support, the other supports for workers, there's work sharing projects, there's wage subsidies up to 90 days for companies and for employees as well, that's in place. And the provincial government themselves have put a series of services on their business strategy to provide for keeping the economy active and to provide for ongoing services to businesses. But there's also work being done on not-for-profit and organizations. And the CRA, for example, if HAAC or other organizations or society needed to have a worker CRA person to offer their services, they're willing to do that. And I could pass that information on to you, Sharon, as well.
Yes, I was going to just say this information is so important. If you wouldn't mind, Rustam, sending us some of this in bullet form in sort of plain language, I'm sure will be delighted to put it on the webpage for people. Obviously, this information is available publicly, but it is a lot easier for folks to be able to see it on our website and then know where to go. It just, if we can help in that way, that's what we want to try to do.
Excellent.
So please do send us whatever you can, and the more succinct and the more point form, the better.
Yeah, no, and we understand that fully. What we've been trying to do, we're no different from everybody else. We're inundated with emails and files and information. So we've been trying to filter and pull out the pertinent pieces. We've been meeting, the chamber is having meetings 3 times a week, Monday, Wednesday, and Friday, going through some of this stuff. And if somebody from HAAC wish to join that too, there's a lot of information there that you can take out for your constituents and transfer it out. There are a lot of folks here from different governmental agencies, but also other partners who actually attend those meetings online. It's a web-based meeting, so we'll be pleased, certainly be pleased to do that. The province have some services in place as well that since the state of emergency last week, that they put in supports, which we can actually share with you on the coronavirus page on the province sector, and that has a lot of the information that we have. One of the things that I think I told Veronica when we were setting this up, that's out there, that's immediate and can help vulnerable folks directly, is the United Way across Atlantic Canada created a fund that's over $2 million. So I think they've dispersed over 100,000 for families who need help and support as well, which is a key one because it's far quicker than the government support. Individuals can assess quite quickly. I encourage folks who have impact in businesses and even impact in their personal that need any questions or any support or wonder how things would work, that we can help on the economic or EI and other sides, then they can give us a call. The government has put a lot of money to the chartered banks and others to help the businesses. So we actually hoping that they don't marginalize our communities anymore when folks go in that direction. But there are other strategies that they're putting on those areas. I don't want to ramble on too much, but
no, thank you, Rustam. It's very, very valuable information for the survival of our Black businesses. So, and also for our families. I'm just thinking as well, maybe you can just add to say something about working out from home. A lot of us are working from home or working remotely. Do you have any tips for what we can do to work well? Sorry?
Well, I said, do I have any tips? My team think I'm a dinosaur on this thing.
You're not alone.
We actually, it's funny because I came to the decision when this all fall. We said, let's put a skeleton team in and we can rotate so not the same people are there. We're going to do all these type of things. And by day 3, I think they probably were planning to create a coup and string me up. But we quickly realized that it was better to get the technology right. We use Microsoft Teams. That's been quite a big help. And we use Zoom for other meetings, but internally we use Microsoft Teams. And we have Salesforce to track, because after all this is done, you need to track what productivity areas you have. We then quickly have team meetings. So we have full staff meetings 3 times a week, Monday, I think, or twice, Monday, Thursday right now, and leadership team meetings 3 times a week in between those meetings and on Friday. So we are ahead of the scope. And then we found that we had to, some of the things that we decided to do is to get the social aspect. We're actually learning. This is a learning curve. So allow folks to put pictures up on Teams, what their workspace look like. Guys put their stuff up with their dog. And there's a little bit more chat because someone mentioned earlier on the mental aspect of this isolation and getting the conversations going. And then we put the team in divisions. So each person then put out aspects. So one of the questions we asked this week that seemed to work well, tell us what you did the last 2 days, and tell us what, if you weren't home, what you would have done in the last 2 days as well. And I think guys like that, it gave us a gauge. And from that, what we'll use is set outputs and outcomes so that at the end of the week, we can then start talking about what we actually did, what we benefit. It is a challenge for somebody at my age. I'm not as young as I look. And I am actually the younger set a little bit more accustomed to that. And I think we try to make sure that most people are using it the right way. For those of you who've been doing it, I'm telling you, it's just as busy as being in the office. I was supposed to be at a meeting last night in Ontario with Minister Ng. And at 7:30, I panicked, got up and thought I missed it, went downstairs, started eating supper, and then realized it hadn't begun yet. Right? And that's how stressed out it is. And that's at 7, 8 at night, which is kind of funny that you're still working at that time, even you're working out of home. So for those of you on the call, it is a new era of working in this type of economy, and the production and strategies that make it worthwhile and getting the information out, the communication that's needed. It has to be swift, because some of the things I tell the team is that, you know, some decisions we made, for example, if we don't get it out today, by tomorrow it's going to be dated. An example is the Prime Minister's release today. We had planned to go up with big stuff on that, and it just all changed, right? With a lot with that information, you know, in terms of the volume of money. So yeah, it's going to take some learning.
Rhonda, if I can jump in real quick around the balance at home, which is something that we talk about and think about. And for those of us who don't do a lot of at-home work, and there are some that do, you still got to maintain that work-life balance. So a lot of people are trying to still take the breaks that they need to take, which is your supper, your lunch, taking, you know, good breaks, getting up and moving around. We used to say a lot of us have standing up desks. So, stand when you're working, because that does help in terms of your health, and so on and so forth. And then we also got to think about it from a gender perspective. Those of us who have kids at home that are primary child providers and trying to maintain work, you need to take that in consideration. And you have to be kind to yourself, because this is new. And so you need to learn to prioritize what is it you're going to do, and lists are helpful. Today, that absolutely needs to be done. And if the other stuff doesn't get done, then it doesn't get done. But you can't be expected to work, which I have been doing, so I can speak it, but I need to practice it, from 8 to 10 at night, because some people's work schedule is going to be very different than yours. So some people, because they put their children to bed, might be working from 8 till 12, and you're going to get the emails coming in. But that doesn't mean that you have to respond from 8 to 12, because your time frame was 8 to 5. So you really need to compartmentalize your work time, your personal time, and take care of yourself. The last thing we need is not to be sick by this virus, but be sick from other things, such as stress, such as flu, such as cold. So if you keep working nonstop without taking care of your personal health, then your immune system is also going to be affected. So you need to create as much as possible that work-life balance within even working from home. And even getting up and down and taking those breaks are really important. And lots of fluids. Water is your friend right now. Water is your friend. Alcohol is easy to reach for, but water is your friend.
Yeah, very true. Thank you for that. Thank you very much for that.
That's excellent. Yeah.
Rhonda, could I just use 1 minute, and maybe not even that? Deacon David has sent me some information regarding the AUBA. So
okay, wonderful.
Bullets. He said one of the things that the churches are doing, they've all canceled their Sunday services and their Bible studies, and they've resorted to using technology, email, online services, praying by text or phone. Funerals are being postponed, as we all know, which impacts the support that the ministers can provide to the families during the challenging time. Their visits to the hospitals for the sick and elderly have been curtailed. So really reaching out to folks by phone. They're calling on their seniors to do a check-in. They're delivering the hot meals to seniors in their community. They're using this opportunity in their churches to wipe down their microphone, do a big major cleanup in their churches, as well as they're joining other churches or funeral homes to get their services out. So I thought it was interesting when they said the funeral homes, because they have the technology, and so they've been going there in order to get their messages across. And then last resort, they're still using in some of the rural areas, postal mail to send newsletters or information to some of their seniors. So that's a quick update from the AUBA perspective.
Okay, wonderful. Thank you. Thank you, Veronica and Deacon David. That's great. That's good to know. Okay, so
I think it's
back to you, Sharon.
Yes, I think it's time to move on to justice and policy. As we knew, it would be challenging to get all of this in, but we're doing our best. So now what I'd like to do is to pass the mic, the virtual mic, over to our online experts. I don't know if Angela Simmons is on, but I certainly know that Robert Wright is. I know that Al Jones is, and I know that Tari is. So Robert, can I give it to you? And then certainly please call out or invite your colleagues. Vanessa, I know, is online, and others. So I'm going to give it to you, Robert, to speak to us about the state of emergency and justice connected information, and then over, and when you are concluded, then to Tari to talk about people who are incarcerated and the impact on them.
Sure. I'll just say a couple of things about the idea of state of emergency, just so that people understand that when a state of emergency is declared, there's, and I won't get into the legislative framework for that by any means, but essentially what happens when a state of emergency is declared either provincially or municipally, it gives that level of government the ability to essentially suspend civil rights for that period of time. provincial legislation allows the government to call a state of emergency for 14 days. That 14-day state of emergency is renewable, and so the government has to come back and redeclare the state of emergency and specify exactly what it is that they are suspending. So I think that Dr. Hawes did say that some of the things that are being required during this period of time, this state of emergency, is this mandatory social isolation, shutting down certain establishments, restricting people from gathering in numbers beyond 5. These are things that the government is requiring us to do that is really not, strictly speaking, outside of the context of a state of emergency. A government can't tell you to do these things, but once they've declared the state of emergency, they can do so. I made some notes just thinking about what does this mean for Black folk and how might Black folk be negatively affected by this. Well, I just said this, that first we need to understand that our populations are disproportionately surveilled and policed in the first place. So if the police have greater powers to surveil and to restrict people's movements, they're probably going to see us moving about first. And so we should be thinking about that. We also should recognize that given our housing, finance, and care resources being more limited in many respects, that we may be more dramatically affected by the social distancing and stay-at-home rules. I also think, though, just reflecting on it, that it's more likely that Black folk, our behavior might be interpreted as dangerous by members of the larger community, because the way we function during this time might look a little different. So, for example, if someone says stay in your household, but your household is naturally connected to your parents' household, then you might interpret social isolation as restricting your movements between 1 or 2 or 3 different households, and that might be ill-perceived by other people who don't have those kinds of linked households. We might also, the suggestion that we stay within our communities has been something that has been suggested. Well, if Black folk are staying within their community by staying within their Black communities, which might exist in different geographic locations but are still seen as one community, that might be something that might be misinterpreted. Of course, there's also during this period of time the tendency to look to racialized people as vectors of disease, and so we need to be conscious of that. So I guess what I would just say to folks is that to be careful, to understand that during this period of time there has been a suspension of certain kinds of civil rights, and that surveillance and may well be increased, and that we should be prepared to kind of frame our behavior within a context that speaks to our cultural needs. Beyond that, I guess I'll just leave it there, other than to say that we should probably be thinking about what kinds of legal supports might be available to members of the Black community who might get caught in what I'm calling the COVID-19 legal trap. In the event that that should happen, we should be thinking about that. And so I know that we haven't heard from folk from DAL Legal Aid or Nova Scotia Legal Aid on this point yet, but we should be certainly thinking about that.
Would you be kind enough, Robert, to share that information with us so that we could also put that on our website, or at least put a link if that is available to you?
Sure. I think I prepared a little memo, a little note on that on email, and I think Bernadette has that, and she can forward it along.
Excellent. Now, would Vanessa, or I don't think Sean is online, but would Vanessa have anything that she would like to add on this justice piece?
The only thing that I will add is that I talked to Bill Trask today from Department of Justice, and he just gave me some information, much of what Robert kind of just alluded to. And what I also gave to him is that there has been some concern about more surveillance of the Black community at this time. And I wanted him to know that working from the Department of Justice, this was a concern. So yeah, I'll let everybody, just add that information, but that's all I have.
Okay. All right. I know that we have Tari and we have Elle Jones online, and I do want to take the opportunity to pass that over and to have some focus on the impact of COVID-19 on people who are incarcerated.
Perfect. Thanks so much, Sharon. Can everyone hear me?
Yes.
Fantastic, fantastic. So I'm going to just talk for like 20, 30 seconds and then hand it over to Elle to kind of describe some of the work that she's been doing in solidarity with other folks for incarcerated folks. But I just wanted to frame kind of this situation in everyone's mind. When we have a crisis situation as this pandemic presents, what it also allows for is a policy window to open, right? And so what is happening now, the kinds of decisions that governments are making or not making, and the kinds of things that they prioritize or do not prioritize, say a great deal about their capacity to imagine different kinds of futures. And so it's actually right now that we need to kind of put concerted effort to try and rectify injustices that have happened within our communities that are harming the health of folks in our communities, including folks who are incarcerated, and being able to support them as best as we can. And so some of the work that Elle, alongside the other folks at East Coast Prison Justice Society and other organizations have been doing is really impactful and may shape the future of the criminal justice system here in Nova Scotia. So with that being said, Elle, I'd love if you could kind of take a couple of minutes here to update folks.
Yeah, thanks, Tari. And I just want to build on that. That was a really important piece, because what we've seen in the last few days is when we want to let people out, it's as easy as opening the doors. So when people tell us we can't incarcerate and we can't do community sentences, we can. So we need to remember that. But with that said, so that's the good piece, that we've actually been able in Nova Scotia to be, I think, a bit of a leader nationally in terms of the kind of releases that have been won provincially. But federally, we have not seen any movement. And I do think it's a crisis and a failure of human rights federally. So some of the issues. So from provincial, one quick issue is there's a big information gap. So they were able to get a visit from public health, but the problem is that visit was supervised by the correctional supervisor. So they weren't really able to ask any questions. And they are now literally left with the impression they're going to die. What they heard is if you get symptoms, you're not getting a ventilator. That is what they heard from that meeting. And what was quoted to me is, at that point, my hands started shaking. So we have a lot of people who believe they've been put aside to die with a lot of anxiety and no information. So we really need to work on getting them health information that's not just terrifying them. They only have a little bit of extra cleaner. We all know, we've seen cold and flu whip around these institutions, so we know what happens. They know what happens, and the biggest problem for them is they know it's going to be staff bringing it in. One of the things that people said to me is these people that abuse you every single day, and now the people that you are dependent on for your well-being, and you also know they're the ones that are going to infect you and then they can leave. So that power dynamic is really frightening for them. So the sanitation in both the jails and prisons is not up. They have no way to socially isolate other than sitting in their cells. And once it hits, they're going to be shut down and basically completely locked down. They have no visits, they have no mental health care, they have nothing happening. They can barely get to phone calls. So that's also causing a huge crisis in their mental health. And so at least provincially, they've seen some people go out, but that's also created, I'm trying to do this fast, sorry. That's also created a gap where we have those who are worthy and those who are unworthy. So for example, we're saying things like low risk or non-violent people, and some people like, I have a violent charge because the Crown stuck me with a violent charge, and I'm not even getting a chance to go to my bail hearing to explain myself because that's being put off because the courts have also canceled bails. And so am I unworthy? Am I now targeted to die? So we've got like a huge division between now those who are worthy to walk out the doors and those who have been divided into what they see as marked for death. So they're having a really visceral response to this. So I think we really need to, especially federally, we really need answers on what's happening, why there are no releases, why people in minimums can't get out. One more quick story just to give you an idea. There's guys in one of the minimum security facilities in Ontario who have to wash the sheets from other facilities. They don't want to do that. They think they're going to get, COVID from washing the sheets, but they can't refuse to work, because if you refuse to work, you get sent back to a higher security institution. You can't get out. So they're basically stuck washing these sheets that they pretty much, again, see them as going to kill them. So some of the things we need to do is, we really need to push for bails not to be canceled and push for the courts. We have had the courts open here, but we need to push for that federally and really make a push on that. I also do want to raise the borders as an issue. Why is it that white snowbirds can come back home, but we're not letting in migrants? Even though under international law, that's also completely illegal, which goes to Robert's points of suspending civil rights. We need to be pushing our government on that. That is illegal. The borders should be open. People should be able to come across and quarantine. What does that mean for Black people when we shut down the border? So I could say more on this, but I'll keep it that short.
Thank you so much, Ellen. I'd just like to reiterate that call about the border. That's been a particular concern. We've got folks that are in immigration detention that are, don't worry, that was just
that was a good
a little bit of saliva going down the wrong pipe. That is not COVID-19.
Well, at least you coughed into your elbow.
There we go, practicing good public health practices. So, we do have folks that are in immigration detention and are not being let out of immigration detention right now. We do have folks, the migrants that are coming to the border that are being sent back to the United States, contravening a particular international human rights declaration whose name is escaping me right now. There are significant challenges that this state of emergency is presenting. And if it is the case that the federal government enacts what was previously called the War Measures Act, but is now called the Emergency Measures Act, some of those kind of human rights suspensions may increase. So it's really important now that we do whatever we can to help advocate and support those that are incarcerated in various ways, whether immigration detention, whether in federal jail, whether in provincial jail, etc.
Well, my goodness, that was tremendous. Thank you so much. There was so much information packed in there, but I did hear it all, and so did the people on the call. And we are going to be able to post this on our website so people can listen again. And if there's information further that Elle, you would like for HAAC to at least put on the website so people can access, or connect to some other link, please do. We are very appreciative of that. All right, with 3 minutes left on this call, I certainly want to give anyone 15 seconds for the last word. Is there anyone who really is dying to say something? Oh, Miss Sheree, is that you?
It is me. Good evening, everybody. Lovely to see so many faces and hear so many voices. I'm wondering if we can, thinking about what Robert just spoke about, Tari and Elle, if we can think collectively about, and this might have happened earlier, collectively about how we can support one another or support people we believe are breaking quarantine, or support people we believe are not practicing physical distancing without calling the police. So how can we support ourselves in our communities, supporting our elders, supporting youth, during this time, during these states of emergency, without calling the police? So how do we, what are some of the things that we can brainstorm for ourselves so we can continue to make sure that our communities are cared for by us?
Okay, well, thank you. And with 1 minute left, I do want to ask Rhonda to share literally just bullets of how we can maintain our wellness. And then at the very end, I will thank everyone on the line, but over to you, Rhonda, for that.
Well, thank you. Thank you, everybody. It's going to be hard to say all of this in that short time, but I will try. So Barb spoke to some of this already, and Dr. Cookie couldn't be with us this evening, but he did have a few tips for us in terms of our mental health. So he does emphasize the fact that this is serious. It is worldwide. We know that. We all need to help in this case, and to make sure that we attend to our mental and physical well-being. It is crucial. One key element of mental health is that we must have structure. So, and particularly with those of us who have children at home, and particularly children need structure, he says. And I know that because I have mine at home. And it's easy to lose sight of that.
Rhonda, can I cut you off for just 1 minute?
Okay, sure.
I just extended it for 15 minutes, so you can slow down if you'd like.
Okay, thank you, Carla. Hopefully everybody can stay with me for a minute here. So Dr. Cookie was emphasizing the importance of keeping structure for the children. So making sure that you're waking up at a certain time and going to sleep at a certain time. Exercise, get outside. It is okay, get outside. And like he said, especially for children. Physical distancing is what we are looking at here. He mentioned about getting away from the term social distancing because people are getting the wrong message. So in other words, you can try to become even more connected with your friends and family via phone and social media, okay? And make sure that you try to do that as much as possible, have video chats. And he's talked about being quarantined as particularly negative on mental health. Essentially, there's research that shows that there are consequences that are 4 times this, like the symptoms are 4 times worse. Some studies are showing. So if we know of somebody who is quarantined, or if we are ourselves quarantined, it's really important that we connect with people frequently and help as much as we can in a safe way. Also, our spiritual and mental health and well-being is important. We know that our community we need to do this in whatever way you can. So whether that's the Bible that you turn to, the Quran, the Torah, meditation and prayer, however you can connect, stay connected. It's really important that we remember to do that. Also, he had mentioned that many churches, and we know this, and maybe Deacon David, if you can get through to us, can speak to this, but many churches have online services available as well. And there are also you have access to spiritual talks on YouTube. Take advantage of all of those things as much as possible. Now more than ever is a time that we need to stay connected and engage. And to also be open to having conversations, even with your children right now, and in your family and your friends, around life and death. Sorry, Barb, were you saying something? Okay, because I know even for my children, I'm seeing some anxiety rising up, and they're asking questions about life and death, and does this virus kill everybody? Some of those messages are out there, and we need to be able to have those conversations, those faith-based conversations that can clear things up for them, and for ourselves as well. So yeah, that's about it. So basically, stay connected, stay healthy, everyone. Get your exercise, eat well. It's key. We have to keep strong. So if anybody else wants to add to that, they can. Ways that you're staying healthy, tips, examples. Hi.
Well,
Rhonda,
okay.
I prepared a little note for a group that I had been working with and will be working with weekly, just trying to help a staff group maintain mental wellness during this period of time. It's a little note. Perhaps I'll just send it to you.
Please do. Yes.
Share it if you want. I tried to cut and paste it into the group chat, but it seems to be a little large for that.
Okay. No, that's wonderful. Thank you.
So, Robert, is it possible to share any part of it in the next 30 seconds?
Sure it is. Just one of the things to say that just things you can do to support your mental health during COVID-19. And I think the first thing is to give yourself permission to acknowledge and experience this as a stressful event. I mean, too often we judge ourselves for our anxieties. No, we're going through something that's very real, and it's okay if you're feeling a little stressed out. Take breaks from watching, reading, or listening to news stories, including social media. Hearing about the pandemic repeatedly can be upsetting. There are people who are responsible for giving you this information. If you are connecting to the public health website and you're getting messages from Dr. Strang's office, that keeps you informed. You don't need to be listening to the news every half hour about this or that. How many cases, new cases there are in Italy? Not really your problem. Disconnect from that stuff if you can't handle it, right? Some other things I say to people is take care of your body. Take deep breaths, stretch or meditate. Try to eat healthy, as Barb was suggesting. Connect with others. Talk with people you trust about your concerns and how you're feeling. It's important to talk about how you're feeling. Read the advisories carefully. I think that too many people are reading the advisories and then behaving as if they're infected and treating everybody around them as if they're infected. So, read the advisories carefully. We want to be careful, but we don't have to walk around as if we're in the middle of some kind of a biblical plague. This is a virus. The people in the know how to manage it. And if we are just careful, we'll get through this fine. And then finally, say, remember that we live in perhaps one of the best countries in the world. We have a public health service that keeps us informed, and in the event of a real crisis, we have institutions that can mobilize to bring us resources to keep us fed and warm if necessary. So we don't need to be hoarding, we don't need to be stockpiling, we don't need to be worried about those kinds of things. We are in a state of emergency, managing a pandemic, but we're still going to the grocery store. We're still able to walk our dogs. We're still able to do these things. This is not a tragedy of biblical proportions. So relax.
Well, I think that's wonderful, and wonderful words to live by as we go through this time. I do want to ask people again, if you have more questions, you may write HAAC, you may call the number. We will try our very best to have information on our website. We are not responsible for all of the sectors in Nova Scotia, but we are more than willing to be a conduit for information for you because we care so very much about all of you. And HAAC wants health in its broadest way for our people. We also want to let you know that we do plan to have another call. It won't be next Friday though. We need a bit of a break from that, and we also want to see how things are moving. So we will certainly give you lots of notice, but it won't be next Friday. And as well, I want to thank every single person who has been on this call. I want to thank you, those of you who have prepared information to share with us. It's been tremendous. And I want to remind you again this week that we as a people have come through all of the things that we've come through. We have tremendous resilience, we're smart, we're capable, and we're loving. And that loving is what's going to get us through perhaps more than anything. So thank you all, and have a good weekend. Keep healthy, keep safe, and keep smiling, keep positive.
Mm-hmm.
All right.
Thank you,
Wonderful.
everyone.
Thank you, everybody.
Thank you, everyone.
Thank you.
Bye,
Thank
everyone.
you too, Sharon.
Okay.